Welcome everybody to our webinar today that we are calling Beyond the Binders, a case study journey to PMP software. We have the privilege, very great privilege, of Jean Sandrock joining us from St. Luke's Hospital. And what we did was just ask for her to share her story of PolicyStat, how she came to us, kind of just how their hospital was going about policy management and ended up choosing PolicyStat, and just really the journey, because a lot of facilities want to hear this story. They want to know if they're alone. They want to know if there's others doing it as well. So again, we were really blessed to have Jean volunteer to help just walk through it and just share their story. We're going to spend most of our time with Jean chatting, but just a quick intro about us. This is PolicyStat. We're software to help manage policies and procedures, and our goal is really to save a lot of time and energy with that. Jean does such a great job. I've seen what she's going to walk through today to walk through what that story looks like. So I'm actually just going to hand the floor over to you, Jean. So Jean, it's all you.
Hi, my name is Jean Sandrock. I'm a nurse, a registered nurse, and I'm going to talk today about our journey to document control. St. Luke's Hospital is where I work. We're in Maumee, Ohio. That is a suburb of Toledo. We have licensed at 314 beds, but due to the renovations over the years and changing to private rooms, we see about 150 to 165 patients is kind of a safe amount that we can care for. We also use DNV GL as our healthcare as our accreditation partner. We'll talk about them in just a minute. We have a unique story to tell and how we got to the using of PolicyStat. We had two kind of factors that were separate but kind of worked together to make it pretty obvious early on last year that we needed to do something to get control of our current policy system. The first part was the hospital, St. Luke's, was involved in a joinder with another system hospital in the Toledo area. And kind of early on into the joinder, there was a challenge by one of the unions to the court, to the FTC, that St. Luke's would, by joining the system, would cause a monopoly of OB beds in the area. So that was in 2010 that this started. We went till last year, kind of thinking we were going to still be able to merge with the system, but then finding out later in the process that we would not and that we would have to divest. So services had been then kind of intermingled, especially the backdoor services, during that 7-year time span. And then we were able to kind of hold separate some of the clinical services. But with that, we had to start separating things, and we found that when we looked at our policies, that we had many that were either missing, not accurate, old, that type of thing. So we were able to look at PolicyStat as an option. So last year, July 1st, was our new Independence Day for the hospital, and with that became a crazy last 18 months of changes and branding and rebranding and trying to figure out who we were as a hospital. It's kind of to the point that we've almost kind of rebirthed this hospital. And then the second factor that kind of influenced our need for PolicyStat, or a policy system, we are a DNV GL hospital. With that, we both follow both of the ISO, which is the International Organization of Standards, and also the NIHO, which is National Integrated Accreditation for Healthcare Organization Standards. So those two pieces make up our quality management system. And one of their standards that they talk about in the NIHO and the ISO is that we need to reduce variation of processes, and that we also need to control our documents and our documented information. And then PolicyStat was one of the ways that we could help to get our policy systems under control. My current role is an RN accreditation specialist, and I began this journey in February of 2016. Prior to that, I've worked 36 and a half years in the ER. So I've been around the hospital for a long time, been involved with it. I was one of the ISO auditors internally for probably 10 years. So I've been around it. It became a new focus with the new job. So pretty much early on, it was pretty easy to see that we really needed to get our hands around our policy system and that we were obviously had a broken system going on. The original policies were from years ago, and they were all kind of kept in a 3-ring binder that everybody had on their floors, and it was just a system that we really had control issues over the copies that were out there. After the original policies, they went to a kind of next generation system that was electronic, but it was a homegrown system. And again, many issues with control. So one of my first things that I did in my new job was kind of take those existing 1,500 plus policies and look at them, kind of come up with a list of what was broken and what we needed to fix. Just a couple examples of things. We had like 4 or 5 different headers going, so that every time somebody changed a secretarial role, when it got put in the next person, something in the header changed. So many problems with that. We had people in departments that were using corporate policies only and had lost or never converted their St. Luke's policies over. We had people that had approvals that were completely missing for years and years and years. So we had like policies from 2005, 6, 7, 8, 9 that really hadn't been updated into the every 3-year cycle like our policy said we should do. So what did we do? We kind of came together as a policy committee. We had people on the committee that could make decisions. I think that was a strong point. We had our CNO there who was very supportive of an electronic system. Overall, we looked at about 5 different policy systems, kind of just the literature on them, and figured out which 2 we really wanted to do a side-by-side comparison for. We chose PolicyStat and one other system. We had both present on the same day, back-to-back, so that people could get a fairly good comparison about what had happened and what each system optioned out and what they offered. And then we sat down as a group. We talked about our pros, we talked about our cons, and it was a pretty obvious, unanimous decision that we liked PolicyStat for ease of use and capability. So what did we do next? We made a request to our administration. We obviously had the support of our Vice President of Patient Care Services and CNO, as she was part of the team. We received our contract from PolicyStat. We ran it through our administrative process for contracts, got that signed and approved. We were able to then start with the implementation process to get going. We had a project manager assigned to our work group, and then we started the process to figure out how we were going to change our system. We knew that we had about 1,500 policies in our old system. What we didn't account for is all of those policies that had departments that had left and had corporate policies, but now had to be brought back in. Our IT system people had merged into the corporate already, so all of the IT policies were gone. Our finance policies were gone, and just a couple other departments that all kind of fit in that same boat. So we should have contracted for more than what we knew we had, but we also knew that we were going to delete some of those that were in there because they were so old. So we did underestimate there, and that was probably one thing that we could, have done a little bit better, but we were able to purchase more from PolicyStat as a one-time policy quantity so that we could get over what we needed to get live in the system. And then we had to figure out how in the heck we were going to address this 1,500 policies and how we were going to make the corrections and changes. There was many, many policies that hadn't been looked at or approved in 8, 10 years. So we needed to have them look at them. And then we had corporate policies that had to be converted. So we kind of looked through our policy team. We worked together for several months. There was some frustration initially trying to figure out how we wanted it to look. We knew we didn't like what we had, but we didn't know exactly what we wanted either. So we had to kind of work through that frustration to figure out where our vision was going. Then I printed a copy of the 1,500 existing electronic policies, put them in piles, sent them off to the managers for them to take a look at, to start making corrections and changes on it. And then we also came up with a form that the managers would sign off on. And it was just like a check sheet to say that, hey, I'm the manager, I reviewed the policy, I'm signing off. It's either been revised, reviewed, or there's no changes to it. And each time somebody submitted a policy with corrections or no changes, it came back with that tracking sheet so that we were able to make sure that what we had and that that person had really signed off on it. One of the fun things that we did, and it was the suggestion again of our CNO, is she said, let's have a policy party. So we went and booked our auditorium. We invited all the managers to come down, bring their piles of their policies, and to have a couple hours that was uninterrupted time that they could go through and make their changes. They could network with people that were in the room if they had questions. And then they would either, when they were done, they came up and put them either in a revised bin, no change bin, or a delete bin. And we were able to go through, the first one was very successful. I don't remember the exact number of policies that we went through, but it was several hundred, which was a big jump in getting them done part. The other thing we did at the policy party is we had a bank of 4 or 5 typers that were there. So they were literally entering the changes, you know, as people were turning them in. We would hand them to them and they'd start typing the changes and send them for upload. So that worked really well. I think we did it probably 4 or 5 times. First one was obviously the most successful, but it did give the managers time to be, you know, working on these uninterrupted, that their staff wasn't readily at the door knocking every 5 minutes to, you know, kind of interrupt them. We also had snacks available for them and just kind of gave them a little bit of time to relax and, you know, get these done for us. So buckets, owners, and approvers. We had to set up how we wanted to have this organized, and we really kind of struggled with this a little bit, but we finally ended up saying we were going to set up 5 different buckets. Originally it was 4. We added our well-care physician practices as our 5th bucket, but we set them up as org, for organizational, anywhere in the hospital that it served, anywhere that it served anywhere in the hospital, and they were set up as both a policy and also a work instruction option, so that, you know, depending on what they wanted to put in, it could go into either place. Our policies started out, we decided they were going to say purpose, scope and responsibility, and procedure. Our work instructions were going to only say process, and then it would be a list of the steps. So it's more of the how-to list of somebody's not here today, how would somebody know how to do their job? So that's how we kind of defined the difference between work instructions and policies. And then we started, you can see by the example on the slide where the policy areas, the organizational, volunteers, and community service would be the policy. Organization, volunteer, and community service would be the work instruction. And we just listed everything down. We have added well care, like I mentioned, and that's our contracted physician practices that the hospital owns. We are in the process of adding them into our system. We're also going to have to figure out, I think we have a solution, but we're going to be adding the name of both WellCare and St. Luke's Hospital into the format so that we can tell that it applies to both areas. So that's just a little bit different. But besides organizational, we have medical staff for MS. PCS was patient care services. SS was support services. So that was, you know, how we kind of came up with how we were going to set up our policy owners. We had owners and approvers. We kind of struggled on this. You know, do you set it up all at the same time, or do we set it up with, we know we're converting, you know, 1,500 policies. We got to get them in. We've got a fairly short timetable. Let's get them in, and then we'll come back, loop around when we've figured out who our approval roles are going to be, and then insert them later. We ended up doing it that way. We did a step 1, step 2, and then on step 2, we literally went back and put in all of the approvers. Hindsight, I might have did that a little bit differently, but it did work for us to get everything in and set up on a timetable that was appropriate. We did have a work and typing pool. We knew with 1,500 policies that our managers couldn't fix all that stuff. So we had dedicated resources from our support coordinators. We've set up 4, and then we've added a 5th of the support coordinators We have 2 for patient care services, and they are split departments. We have 1 for support services and 1 for organizational, and we've newly added the 1 for well care. And they are the ones that were helping with our typing and our uploading and conversion process. They're my expert resources that we use to, fix problems and continue to adjust as we go day to day. They were available for typing. We finally got towards the end and we still had a lot to type, so we worked with our administration, and we had 1 to 2 days a week, and I think the last couple of weeks they maybe had 3 days a week that they were basically typing. They were out of their office, they were in a downstairs in a classroom where nobody was bothering them, and they were pretty productive to get everything done on time. We actually ended up maybe about 2 weeks ahead of time with everything in, which we were happy about that. And like I mentioned before, I think if our process wouldn't have been quite as broken as it was, it might not have taken all that resources. But with the way it was right now and with as many things that were inconsistent, we really needed that consistency of a set group of people helping to get things typed and fixed. So our go live for Policy Stat was on February 21st of 2016. We had a little bit of logistics stuff kind of at the end with the Active Directory, trying to make sure that that was all going to match up. And pretty much all of the policies had been converted at that time. With that, we went live. We had educational rounds that I did and with a couple other people the day or two before, the day of, and then the day or two after to the nursing floors, just saying, hey, did you hear about Policy Stat? This is how you get into the system. And staff was real receptive at that point. The managers had to do a short class on the system, and then we just kind of did rounding at that. So it actually went pretty quickly for the education part of it. And, we'll ask them, and they just feel like, hey, that's really easy to use. We didn't have any problem. We figured it out pretty intuitively. So that's been very good. It's been a year and a half-ish right now, and we had maybe 2 or 3 people that had questions or issues early on, and I've not heard any negative comments since, so that's been very good. I think we had maybe 2 or 3 people that had questions or issues early on, and I've not heard any negative comments since then. I've always kind of teased everybody. I said this was probably the easiest implementation of an IT software product that has been very well received without any griping, and everybody just really liked it and uses it. So that's really great. We had an accreditation visit the year before that talked about document control as one of our actual findings. So we were able to use our Policy Stat success story in 2017. And we highlighted that to our survey team, and they were impressed by our process at that point. Our current status right now is over 2,100 and still adding as we go. We fixed the departments that were missing. We added their policies back in under St. Luke's. We had to update our format of all of our scopes of service due to the changes in both the ISO and the NIHO standards. So we've just completed about 75 of the different departmental scopes of service with the new format. All the senior leaders and the managers have been in the process in the approval trails and having to learn a little bit more about the system as they've had to approve and to get everything up and running with that. And, I think the moral of our story is that electronic management is the way to go. You don't have any more, you give the policy to the secretary to type, they send it back to you, you lose it in the meantime, you can't find it, that all goes away. It is all electronic. Once you get it in the system, all the approvals are done, the notifications are done, you get the reminders pre-policy time to expire, you get the ones when they're overdue. It really has, helped push our leaders to get things up, running, and then approved. With that, our lessons learned. We had a couple things that we thought were maybe opportunities that could have went a little bit easier than they did. And one of them was just maybe a little bit more direction from Policy Stat in that early phase of, I don't know where to start. That would have been a little bit more helpful. I think we got there, but I think we had a couple of weeks of what in the heck's going on and how do we do this? But we did make it, and we've succeeded with the whole project. Also, it might have been helpful to see like an example from another client to see what the end product would look like, just to give you at least a little bit. Everybody knows that there's going to be differences in your institution, but to just show them what somebody else's system is going to actually look like. And then there's just a few things in the editing process that we've kind of stumbled a little bit with. The tables feature sometimes is hard to work with. We've had some issues with indentation and numbering. It's just a little bit tricky to get the formatting for. And a little bit with template limitations. It uses the HTML formatting with only one title in the header. And with using our WellCare, which is a separate corporation, we were trying to get their logo and the hospital logo in the header, and that just hasn't worked. So we're doing it a little bit differently and indicating in the body of the text that this applies to both areas. The positives, we always had weekly conference calls to work in the issues through. All of the support coordinators would come down to my office and we'd have a meeting, and we'd talk with Erin, who was our person for our implementation consultant, weekly, and we would then meet after we were done with the conference call and talk about any issues that the support coordinators were facing at that point. There's tutorials that are available within the system, and it really is easy to use, and the staff does love the system. And with that closes my presentation. We enjoy PolicyStat. It's worked well for our institution, and I hope that everybody's had good experiences with PolicyStat. Thank you.
Thank you, Jean. I really appreciate you sharing that story with us. You just walked through so many things and how you went about what you did, and we just really appreciate you guiding us through it all. So thank you, really underscore, thank you so much for that. She mentioned a few items at the end that she called opportunities, and we've actually addressed a lot of those with projects since she's worked with us, and then there's a few items we're actually reaching out to her that we can actually address. There's a lot that PolicyStat can do, and trying to make sure that our customers are always aware of it is a big piece of that. So again, by all means, she just walked through it. If you want to see what the software does in action, you want us to have a demo with you, kind of get the interactive piece, maybe talk through scenarios that were not exactly like St. Luke's that your facility is encountering, by all means, get in touch with us. Our website, policystat.com, or reach out to us, info@policystat.com, and we are happy to help you. Thank you so much for joining us today. Take care.